Hi, my name is Dr. Ashley Fields. I am a board certified physician in family and sports medicine here at the Avance North Durham location. And I just wanted to take a few minutes of your time just to talk about lower ankle injuries, specifically lateral ankle sprains, because we're heading into our summer months and we're going to get outside and be a little bit more active. And lateral ankle sprains are some of the most common injuries that we see in our primary care clinics and in the emergency room, and they account for 2 million injuries a year in the United States. So one of the things that I see a lot of times when my patients come into clinic is, hey doc, I've rolled my ankle. So what exactly does that mean? A lot of times that can mean, hey, either they rotated their ankle inward, and I'm gonna try my best with this to kind of give you an idea of what's going on, but they rotated their ankle inward or outward. When you rotate your ankle outward, you're doing what we call an eversion injury. When you rotate your ankle inward, that means that you're doing a inversion injury. And those are the more common injuries that we see with lateral ankle sprains. With lateral ankle sprains, your ATFL, which is going to be in this area, is where we see the most ankle sprains. We're concerned with ankle sprains, specifically when it's a child or an adult, simply because with children, they have growth plates. So it's hard to determine if you have a growth plate injury with children versus just being an ankle sprain. And we're also concerned with it being a fracture or a higher ankle sprain, or also an ankle sprain in other areas like in your midfoot, or even a osteochondral lesion, which is where you have damage to your cartilage in your bone. So it's always good to kind of see your healthcare provider just to get a little bit more information from them. So what to do when you have acute injury, or what can you do at home? You want to follow the acronym called POLICE, which is P for protection, where you want to protect that injured ankle. But that can be using crutches, so you can take as much pressure off of that area as tolerated or as needed. You want to provide optimal loading, which stands for the OL, where you're going to apply load to that injured area as tolerated, because that'll help stimulate the healing process. And you want to provide ice, which is your I, which will help with the swelling and the pain. C, which is going to be for your compression, which is going to help also with the swelling, and E, which will also help with the swelling by elevating your ankle. So those are just some tidbits that you can do at home in the meantime. Also, while you're at home with the ice, one of the things that I tell my patients is, obviously ice is great. Get a bag of ice or a frozen ice bag that you can find in the store. But I like kids especially to use frozen vegetables. I say get something like peas or some type of food that they don't like that's frozen, and you can manipulate that bag into the shape of the ankle where it hurts, and that'll kind of help with the pain and the swelling. You can do that anywhere from 15 to 20 minutes at a time, and at least 4 times a day within the first 24 to 72 hours. Also, we recommend you taking an anti-inflammatory medication within that time period, which can be Motrin or Advil or even Tylenol. I don't really recommend you taking opioids if really necessary, just because there's a lot of side effects that comes with using opioids, and your anti-inflammatory medications and your Tylenol will be a very good start for your treatment in the initial stages.